Lawrence is just north of Boston, along the Merrimack River, where these once booming textile mills stand as testament to the city's proud history of industry and labor activism. Long known as Immigrant City, the title has never been more fitting. Lawrence is home to the largest Latino population in New England. The community struggles with a child poverty rate of 39%, more than twice the state average. But Lawrence's spirit of activism lives on today, with partners coming together to meet challenges by broadening the way its citizens think about community health.
We have a lot of strengths in our city. One of them definitely is resiliency. We have a city that has changed over time, but it has to remain strong and has figured out a way to be creative with collaborations and partnerships. And our collaborative efforts have yielded great results in a greater and healthier community.
We have a lot of folks in Lawrence who are navigating a new culture, a new country for the first time, and they have a lot of strengths. But what they don't have is a knowledge of how the systems work. The Lawrence Working Families Initiative is a special cross-sector collaboration. We have a school system that's in receivership, and a lot of resources are being invested in helping the children advance academically.
We're trying to close the achievement gap, and so they're working with parents to promote economic self-sufficiency.
Children perform better in school when their families are healthier and more economically successful.
The Family Resource Center is sort of a one-stop shop where parents can go, not only enroll their kids, but also get connected to services that really support the family.
When we're talking to parents, let's bring them back to being a hub of services.
What we did is recruit 5 parents as connectors.
This is number 30. 40.
This is a place where I can go to get connected to a primary care physician or a job coach or a training program. And the parent ambassadors are connectors to that community hub.
The mills are so characteristic of Lawrence, and I think that's going to carry the past into the future. Our population has grown significantly, but our housing stock has not really matched that. And so the mills come to sort of address the issue of housing, but also as a piece of economic development. It just showcases our future.
Economic development efforts in the city. Our organization has developed about 157 units of housing in the community. 60 of those so far are in this mill, and then we have another 73 units in a mill across the street that is going to be coming online next year. Housing is an integral part of a larger strategy that includes preventive health, access to employment, and financial education that are all pieces of improving the health and well-being of a community.
The Greater Lawrence Family Health Center started in 1980 to meet the needs of Lawrence. We are only about 25 minutes from Boston, but we still had great difficulty attracting primary care physicians.
She was positive for sensorineural hearing loss.
So the decision was made to grow our own, so to speak. It's been a tremendous success. We've now been a residency for 20 years.
We're requesting to have a disability form filled out, but in the midst...
We're looking for people that have a demonstrated commitment to underserved communities, people who, if they don't know Spanish, want to learn Spanish, want to develop to be servant leaders. We've been very successful attracting those type of people.
Okay, Angela. ¿Ellos van a venir también? ¿Sí?
We are working to make Lawrence a better community, a healthier community from the ground up. By training in a place like this in the community where you're embedded in the community and everybody you're working with is also sharing that same sense of mission, you're able to actually feed and grow that thing that brought you to medicine in the first place.
There's really a renaissance on how we build a community around this idea of a healthy place to live. At its very basic core, we're trying to make Lawrence a safer place to live. Of course, it's really where the rubber meets the road between people and the healthy environment that we're trying to build.
The Spigot Ribbon Greenway is the result of 15 years of planning, and now it is a beautiful space, 3.5 miles of open space to connect our city.
It goes through some of the most vibrant neighborhoods in the city, some of the more condensed neighborhoods in the city. So I think it's something great because people actually have now a backyard where to play, where to exercise, where to have fun. People enjoy it so much.
Ciclovia is really our open street concept. We're trying to promote physical activity to address the issue of obesity, diabetes, and chronic diseases. And so by opening a space and allowing families to come outside on the street in a way that's safe to exercise is our way of saying, you know what, our city really cares about our community. It is a very unique way for us to say, you know what, come out and play. We have been able to sort of capitalize on all those things to make this a better community, to connect health with work, with educational attainment, with closing that achievement gap for kids. So I think all these little things impact health. And so health is in all policies. And when you truly understand that, then you can create a culture of health. This is ongoing work. We're very happy with what we have been able to accomplish, but the journey continues because Lawrence is only going to go further and further.